let's move on. Very few among us, of course, would question the amazing work that GPs and healthcare workers, doctors and nurses, etc., have all done over the last 18 months. However, it is unquestionable that when it comes to getting access to our GP, appointments are now rarer than a rare thing from rare land when it comes to trying to get in there face to face. I always make the same statement when I talk about this topic. Trying to get in to my GP is like an Olympic sport. You've got to be fastest finger first at 8 o'clock, and then goodness knows how many people have managed somehow to get in there before you at 8 o'clock, even though you were there poised on the telephone waiting. But anyway, as the waiting list grows, so too apparently does the average GP income. It's gone up 11% in the last 4 years. And now on average, a family doctor earns over £100,000 a year. So when you hear that, because of course that £100,000 a year is coming from your taxes, do you feel like you're getting good value for money? Joining me now from the Taxpayers Alliance is Danielle Boxall. Danielle, these guys are highly qualified people. Why shouldn't they be earning high salaries like this?
Well, thanks for having me on, Michelle. Well, I think I'd like to start off by saying that there are two types of GPs that are included in this £100,000 figure. There are sort of salaried GPs that are employed, and then there are GPs that run surgeries and they run practices, and they take their salary by essentially they get an income from the NHS based on how many patients they put on their books and a number of other things. And they pay the doctors that they employ, they pay other staff, they pay for the running costs, and then anything that's left over, any profit essentially, they take home. So we end up seeing over 270 GPs in England and Wales taking incomes over £200,000. And the nation's highest paid GP actually takes in over £700,000 or around £700,000 a year. So there's obviously a big disparity here between different GPs and the amount of money that they take home. So whilst they may be well qualified, when people aren't able to see their GP, like you mentioned, taxpayers are right to question whether they think they're getting value for money from their local services.
Yeah, and I mean, we were discussing, I think it was a couple of days ago on this very show, the fact that there's a shortage of GPs. And I have to say, when you talk about earning £700,000 a year or 200 plus or even 100 plus, it blows my mind why aren't people queuing up in their droves to get into this sector? Why do you think there's a potential shortage in this way then of GPs if this is the money that is on offer?
Well, of course, this is a minority of GPs that take huge salaries like that. So the majority of salaried GPs, which are ones that are employed by a surgery, earn around £63,000. So it's a lot lower. It's actually 11 times less than the highest earning GP that I mentioned earlier. So obviously there is a huge disparity, and I think it might anger some GPs that when they see that there are some of their fellow colleagues are earning a lot of money. And this is despite waiting times going up. This is despite practices being closed and services not being up to scratch, appointments being very difficult to make in person. So obviously there is a bit of a disparity here going on. Perhaps that's what puts off some people from becoming a GP.
And talk about disparity. One of the things that I found interesting on this report today was about the gender pay gap. Male GPs apparently, on average, are earning £122,800 compared to £82,900 for women. What's that about?
Well, of course, there's lots of different reasons why that could be. I mean, there might be some female GPs that take a few days off work because they have children or childcare issues. Of course, you know, there is a more social question here about whether men should also be taking time off for that sort of duty. But I think the real issue here is, you know, are taxpayers getting value for money that they want to see? And this isn't just about GPs. Of course, this is about lots of other parts of the public sector. I mean, we recently revealed that there is over 2,800 council employees that earn over £100,000, and that's despite council services not quite being up to scratch. Perhaps a lot of residents not very happy with, you know, their bin collection services, for example, and things like that. So it's not just about GPs; it's about the whole of the public sector. are taxpayers getting value for money? And if they're not, then how can we improve that?
Indeed. Are we getting value for money? That is a topic that I love to discuss. Danielle Boxall, thank you very much for your time.